Hi, my name is Janae, and the policy I chose is the Patient Protection and Affordable Care Act. I chose this policy because I believe it provides help and support to those who aren't fortunate enough to afford healthcare services, and it also improves the overall health of the individuals in our community. This policy was developed and enacted in order to facilitate in the purchase of healthcare services through subsidies, tax credits, and healthcare exchanges. This policy was enacted in March 23, 2010. The policy mainly affects those who are in lower income households, poverty communities, and even uninsured individuals who aren't able to afford these healthcare services. Statistics show that the results of this policy has changed since an enactment and that there have been positive impacts on it. Some highlights and positive outcomes show in studies that between 2013 and 2016, the number of uninsured individuals has declined by 39.6%. Also, 10.3 million individuals in the U.S. were enrolled in healthcare plans that were offered through health insurance exchanges in 2017. Another thing is the total enrollment of Medicaid has totaled to roughly $75 million in May of 2017. With every policy, there are good and bad. The overall good is that the number of uninsured individuals has decreased since its enactment. And also, the monthly Medicaid enrollment has steadily increased since this policy has been enacted. There are also downsides to every policy. The biggest downside is that this policy entails a lot of money from our federal government and taxpayers. In 2016, studies showed that the Congressional Budget Office estimated that the federal government would spend about $8.9 trillion between 2017 and 2016. And this is about $1.4 trillion higher than if the Affordable Care Act had never been enacted. Also, another downfall to this policy is that the wealthy that have to pay higher taxes feel like it isn't fair that they are paying for not only themselves, but also those who are in low income households and those who are in poverty communities and can't afford these. And these, the wealthier feel like it's not fair for them that they have to pay for them as well as themselves. Personally, I believe the Affordable Care Act policy is a good policy. It overall has shown positive impacts on our country and to those who aren't able to afford these healthcare services. Also, it has decreased mortality rates and it has just improved the overall health of our country. And I believe that it should be continued because of the positive impacts that have been shown through these studies of this policy. Thank you.